But first, let me just begin with the top line, and that is the total number of new positive cases here in the state of California over the last 24 hours. We report today some 4,890 individuals tested positive for COVID-19. Tragically, we lost 79 lives in the last reporting period, and we have seen a modest increase both in hospitalizations and total number of ICU patients in the state. Hospitalizations went up some 3.3% in the last 24 hours. ICU patient volume went up 4.4%. As I've been doing over the course of the last number of days, we have been marking trend lines that increasingly are headlines across the nation as it relates to positivity rates in the state of California. And I'll remind everybody that positivity rates become foundational as we increase the total number of tests. And remember, just a day or so ago, we announced over 101,000 tests that were completed in a 24-hour period in the state of California. As we increase tests in the state of California, naturally, we are going to see an increased number and total number of individuals that test positive. It becomes, though, important that we look at positivity rates. That's the percentage of those that we test that test positive, to really give us a sign, an indication of what we refer to as community spread. I've noted on charts that I've provided over the last number of days that when we did the first 14-day cohort, going back to April, in terms of the positivity rate, we had spiked at 40.8%. Last 14-day cohort period that is up to date, that includes the last 24 hours, our positivity rate is at 5.3%. That's slightly higher than the 5.1% we saw a few days ago, and the 7-day trend higher still at 5.7%. So positivity rate in the state of California over a 14-day period, 5.3%, over a 7-day period, 5.7%. We were able to conduct not 101,000 tests as we did 48 hours ago, but in the last 24 hours, we conducted 77,000 tests. Let me just take a moment on the test to mark a following consideration. I noted yesterday that we've averaged 88,000 tests a day over the last 7-day period. That 100+ thousand testing marked certainly a milestone in the state. I want to say two things about testing. We still need to test more people, number one. Number two, I also want to mark appreciation. Today, we end the formal task force, the testing task force that we put together a number of months ago. And I want to thank the co-chairs of that task force, Dr. Charity Dean and Paul Markovich from Blue Shield. They did an outstanding job. I cannot be more grateful on behalf of a grateful state for their efforts. The fact that we've averaged over 88,000 tests over the last week is testament to their efforts and their entire team that they put together. Recall, just a few months ago, we were testing just shy of 2,500 people every day, 2,500 a day. Their efforts, they were able to achieve milestones that we set out at 15,000 a day, 25,000 a day, a goal of 60,000 a day, a stretch goal of 80,000, and here we are with their efforts demonstrably advanced. And I want to just again congratulate them on a job well done and thank them for volunteering to take that role and that responsibility. We'll be reconstituting that task force now with a different frame of focus and a different energy in terms of now looking to more target our testing, what some would refer to perhaps lazily as smart testing, or just more targeted testing at communities that have been underserved, under-resourced. And so the next iteration of our testing, we still want to see the volume, But it's not just the volume we want to see. We want to see a specificity of testing and a sophistication of the type and target of the testing. And so we'll be making more announcements in the next number of days and weeks related to those efforts. But I just, again, want to thank our co-chairs for their outstanding leadership. We've been monitoring, and I've made this point abundantly clear over the course of the last number of days, we've been monitoring all 58 counties in the state of California for community spread. We've been looking at the positivity rates. We've been looking at ICU volume. We've been looking at total number of hospitalizations, not just deaths, the most lagging of indicators as it relates to this pandemic. We've been doing so recognizing, and I can't again say this enough, that California is the size of 21 states combined. The size and scope and scale of California require a disciplined understanding that there are parts of this state that are very distinct and unique from other parts of this state. So when I begin these presentations, as I've done today, I talk in the aggregate. But again, none of us live in the aggregate. We live in counties, we live in cities within counties, communities, large and small, where conditions are very distinctive from one another. And so while we monitor all 58 counties in the state of California, we target our engagement and efforts based upon conditions that present themselves. We talk in terms of these attestations. These are the guidelines that we put forth at a state level that must be met in order for counties to come forward with their health officials, their health directors, and their county representatives to attest that they have plans, protection plans, and containment plans for this virus. Those are point in time. As some of their attestations change based upon conditions, we offer technical assistance at the state level. We've done that now for 15 counties that are formally on what we refer to as our watch list, where we're providing more formal, more targeted support. By the way, that's not just for counties that have attested. I'll give you an example. Imperial County has never moved forward with an attestation because they recognize they couldn't meet the criteria the state of California has put forward. But nonetheless, we are engaging them with technical assistance. They're one of 15 counties that we're actively working to address considerations, concerns, trends within their various counties. As it relates to Imperial County, we've made it abundantly clear over the course of many, many weeks, arguably over the course of many, many months, that Imperial County's conditions required a unique set of support and counsel. And as a consequence, we have made it clear over the course of many months now that we've been sending additional resources down into Imperial County. Imperial County is unique in this respect. We have now had over 500 individuals transferred out of the hospital system in Imperial County just over the last 5 weeks. We've averaged anywhere on a low of 15, but more, about 17 individuals every single day that we're transferring out of their system, decompressing their system in the county, and then providing supports in surrounding counties. What has become crystal clear over the course of many months is these interventions, while they've been forceful and they have been helpful and certainly allowed for decompression of that hospital system, provided additional supports, that we are now in a position where we are working with county officials and advising them to pull back and once again reinstitute their stay-at-home orders. We have been working with county health officers and with their city administrator. And I just want to thank the county health officer, city administrator, members of their elected body for their stewardship and their support and their collaborative spirit over the course of many, many weeks, including the conversations that we had today with our key health officials. They are going to be convening their county supervisors and county leadership over the course of the next few days and making a determination to lead that effort at a local level. We are advising and counseling asking them to move forward and reinstitute the stay-at-home order, but they will move at their discretion. If they are not able to come to some consensus, I am committed to intervening, as is my role and responsibility as governor in the state of California. But I am confident in their capacity to make that determination for themselves based upon, again, the criteria of conditions that continue to persist in the county. Let me underscore what those conditions include. Not only the need to decompress their hospital system because they simply can't absorb the number of patients with the limited resources in that county, but also a positivity rate. I noted a positivity rate over a 14-day period in the state of California at 5.3%. The positivity rate over a 14-day period in Imperial County is approaching 23%. We have sent what we call these FMAT teams down, 69 individuals that have gone down into the county to help support their efforts. I even brought 44 National Guards men and women in their medical unit down into the county over the last number of weeks. We brought out support a number of weeks back, what we refer to as FMS. These are the field medical stations. We provided 80 beds to help decompress their system for non-acute patients. This was done in support with FEMA and our federal partners. CDC has been down, HHS has been down. We're working with Customs and Border Control because of issues as it relates to the border in Mexicali and Calexico and issues that we have to address in and around that border. We obviously are at a point now where the impacts in surrounding counties, the impacts in the public health within the counties is such that we believe it is time to dial back as it relates to their efforts. Remember, they never moved forward as far as other parts of the state, but nonetheless the conditions are such that it's time to pull back further. We have 2 OptumServe sites. You may recall the OptumServe is our partnership for testing sites that are in the community. We've also provided 1.1, almost 1.2 million, 1.151 to be exact, a million masks into a community that includes 180,000 population. 1.1 million masks we have distributed down into the county. Over 500,000 N95 masks, just shy, excuse me, of 500,000 N95 masks. We have provided gowns, gloves, face shields, and the like. We are committed to providing more resources in real time to help support their efforts, as well as I recognize good enough never is. And we are finally in a position with these large contracts where now we've received just from one contract, BYD, 33 million N95 masks. We're in a much better place now to even be more supportive to our friends, our partners, and community in Imperial County. And so these are the efforts that we wanted to update you on today. We continue to press even more efforts. I want to just acknowledge Vice President Pence, who has reached out and to support those efforts in the county proper. I want to thank incredible leadership, Bob Fenton and FEMA, and their partnerships and their stewardship and focus on the needs of this county. And I want to just thank our team that includes the Department of Labor, includes EMSA, and partnerships there. It's Department of California Department of Public Health that has strike teams down there. In addition now to our agricultural partners and additional partnerships from state agencies that are now helping support the cause of mitigating the spread of this virus in the county. Final point, I also want to acknowledge our leadership of Mark Gilladucci at the Office of Emergency Service. There's one county in the state where we are providing 100% of the costs related to the emergency response. It's in this county where FEMA traditionally will pick up 75% of the cost, 25% of the costs are borne by the state and local government. There's no cost that we are assessing related to that partnership with FEMA in Imperial County. That partnership, we are absorbing those costs, we are absorbing as well. So look, we recognize the economic costs of what we are arguing for. We recognize the economic costs that COVID-19 has already impacted on the community, but we recognize now our responsibility to keep people healthy, keep people safe, and step up our efforts. So 15 counties overall that we're monitoring very, very closely. All 58, of course, that we have oversight and continue to monitor. Numbers, 4,890 positive tests, a little bit better than yesterday, a little bit better than that record number north of 7,000 a few days ago. But these trend lines over the last 7 days, over the last 14 days, are disturbing, and that's why I cannot impress upon people more to wear these masks when they cannot practice physical distancing, to continue to be vigilant about the spread of this virus. We are entering into a weekend where so often it's the case, people let their guard down. Do not be one of those individuals. Continue to practice physical distancing, social distancing. If you are going to break with tradition, common sense, and you're going to invite your neighbors or friends or extended family members over against the advice and counsel of local health directives, wear a mask, practice physical distancing, express your appreciation, your friendship, and your willingness to reach out and connect with others in a way that keeps them safe and keeps you safe as well. That said, and I will repeat this message before I let you all go, unless you want to turn off this communication, which I appreciate. But first, I want to ask Dr. Angell to come up and talk a little bit more about the 15 counties that we're monitoring, but particularly this one county in Southern California that needs particular attention. And then I'll get to why we are here at this wonderful warehouse facility in the first place, update you on a new partnership to help support California manufacturing and help support job creation in the state of California as well. Dr. Angell?
Thank you, Governor, for this opportunity to talk a little bit about Imperial County and why we are sharing this announcement today about our actions in that community. As mentioned, Imperial County is one of 15 counties that are on our county monitoring list. This county monitoring list was created for California to be able to work very closely with our counties, but be there particularly when the needs are most. And those needs that are identified to put one on the county monitoring list includes variables that let us assess the movement of disease, so epidemiologic measures, our understanding of the capacity in the hospital, in the care delivery system, and also an understanding of testing capacity. Those are sort of three simple areas in which we, in order to identify those counties that should be watched and worked with more closely. And we really appreciate the collaboration of all of our counties as we work through this process. Imperial County, as mentioned, has been on our monitoring list, and we've been working very closely with them, and they've been excellent partners as we move forward. But there are a couple of indicators at this point that make us particularly concerned. This includes their case rate over the past 7 days, which is 680. That's vastly above the 100 over the last 14 days that's required to get onto the monitoring list. That is part of the threshold, well above, and it has been maintained at that level. Additionally, the test positivity at 23% is particularly concerning as well. That's well over the 10% threshold that is noted to get onto this monitoring list. The 23% tells us not only that there are many cases, but there are likely very many undetected cases. So that together, combined also with the conversations we have had with the counties, and most particularly our understanding of the impact that it's having on the care delivery system, has moved us to take this much more directed and focused attention effort with Imperial County at this time. So we're working very closely with county officials on this, and we will be working with them as we advise them to be stepping back moving back from where they currently are in terms of their movement through the stages in California, and looking at ways in which we can work much more effectively through on-the-ground attention and support also from many of our different agencies to help support that county moving back and addressing the really concerning increased rates and continuing increased rates that we're seeing in Imperial County at this time.